I am here again today with Bonny Specker, epidemiologist, who is going to talk to us about what has been happening with COVID-19 over the last couple of weeks in our state, in our region, across the nation, and in the world. But also, she's going to talk to us a little bit today about some hot spots in the U.S. and the current Delta variant, which is a topic that you've probably heard about quite frequently in the news. That's something that everybody's talking about right now. Bonny, can you tell us a little bit about what's going on?
Sure. Um, First, as far as the current hotspots, I thought this would be a good map to show people, especially this time of year when you're planning on vacations. I know I'll be looking at this map. It gets posted every day in the Washington Post. Before we head out on vacation, just to see which states we should drive through and which ones would probably be better to avoid. But you can see South Dakota on this map is looking pretty good. The states that are having a hard time right now are Missouri, Arkansas, Louisiana. Just in the past week has really kind of blown up. Missouri has had a rough time for the last week or so. And this will come up again later, but remember this Missouri area. Now you'll see Nebraska here and Oklahoma don't have any data, and that's because the sources, the data sources that this website uses, this is by county. So these are county level data. Each dot is a county, and those particular states don't provide county specific data. And that's true for some counties in Florida as well. So this map, the state of Florida is not quite accurate, as well as Oklahoma and Nebraska. This is the regions of the United States as defined by the U.S. Department of Health and Human Services. And South Dakota is here in Region 8. Missouri is down there in Region 7. And they are providing, the CDC's providing information on that Delta variant based on region of the United States. And that's because they don't sample enough from each individual state or genotype, the virus from enough samples in each individual state to provide state level data. So they've pooled the data by these regions and are providing it that way. Now the Region 8 includes not just South Dakota, but North Dakota, Montana, Wyoming, Colorado, and Utah. And this is the results that came out yesterday on the CDC website. And I'll provide that link so that Chelsea can include it in the video. But here in Region 8, this dark orange bar is the percent of the SARS-CoV-2 virus in the previous 2 weeks that is the Delta virus. So you can see back here in early June 5th, the 2 weeks, if you pooled all the samples that were genotyped the 2 weeks prior to June 5th, it comes out about 27% of them were the Delta virus or the Delta variant. And as of July 3rd, 74% of them are the Delta virus in this Region 8 area. So we don't have, again, South Dakota specific data, but for the region that we're located in, that percent of that of the virus that's the Delta variant has become quite large. So during the 2 weeks prior to July 7th, the prevalence in the region containing Missouri of the Delta virus was 81%. And the Missouri prevalence back on June 19th was 73%. That's about where we are now. The region containing South Dakota is currently 74%, and whereas the prevalence in the US is 52%. So we have a higher prevalence of that Delta virus than the whole country as a whole. And one of the things I just want to mention while we're talking about that Delta virus if you look at the states that have had more than 300 samples genotyped in the previous month, the CDC posts those results, and South Dakota hasn't had that many. So again, that's why we don't have any state-specific data. But Colorado and Wyoming have an actual high percent of Delta virus. And if you look at the state of South Dakota right now, the counties that are in moderate spread that are increasing actually are the counties in western South Dakota. So right now, I think the Delta virus may, and this is all speculation, there's no data to support this, but I'm imagining that the Delta virus is more in the western side of the state currently than in the eastern side of the state, just based on the Wyoming and Colorado data, and then also the increases that we're seeing in Pennington and Lawrence counties. If you look at state rankings, South Dakota has the following rankings. This was as of yesterday. It's the 7th highest percent positive test in the last 7 days. South Dakota having 7% test positivity compared to the US at 3%. That's not good. You want to have a low percent test positivity. They're actually 3rd from the bottom in the number of new tests reported. That's also not very good. You want to be doing a lot of tests so that you can identify people that have this virus. So we would want to have a high number. We're at 381 per 100,000, whereas across the country it's at 785. So the more tests, the better. We have had the 3rd highest total reported cases out of all of the states, and the 10th highest total reported deaths, and that's adjusted for population size. Right now, we have the 26th highest number of people fully vaccinated. About 45% of the population's vaccinated, fully vaccinated. That's having the 2nd shot and 2 weeks out. Whereas in the US, it's at about 47%. These numbers are essentially percents if you look at just this part here, since it's per 100,000.
How do we compare, just out of curiosity, how do we compare to Missouri as far as our vaccination rates? Do you know?
I'm not sure, and it would be probably good to look at how we compare to Missouri a month ago, what Missouri was a month ago, because with the large increase in the cases, a lot of people have decided to get vaccinated.
Good.
So the vaccination rate in Missouri, I would bet has increased significantly in the last couple of weeks because they've seen this outbreak. So, and that's actually, Chelsea, now that you mentioned that, that's an important thing to remind people, is that if you look at the mRNA vaccines against this Delta virus, you really need to have 2 of them to be effective, for the vaccine to be effective. And, you know, if you look at Pfizer and Moderna, the first vaccine, you know, here, and then you have 3 or 4 weeks later, you're getting the 2nd vaccine, and then it's 2 weeks after that that you're considered fully vaccinated, because it takes time for your body to respond. So you're talking about a 5 or 6 week window where once you start the vaccine series, you're not really fully vaccinated for a month and a half. So that's important when you're talking about a virus coming into a community. If all of a sudden people decide, well, we need to get vaccinated, it's going to be 6 weeks before they're actually protected from the time of that first vaccine. So I hope people realize that once you get vaccinated, that first vaccine isn't going to do anything for a while, especially against this Delta virus. So it's important to start that vaccine series before the Delta virus becomes an issue in your community. Now, looking at the weekly summaries, one thing I wanted to mention to people is that the Department of Health is now updating their dashboard just once a week rather than every day. That won't affect this particular data summary because I also converted to doing it just once a week, and fortunately we're both doing it on the same day. It may mean that my weekly summary on Wednesdays might come out a little bit later in the day, than since I need to wait for them to get theirs posted, but it shouldn't make a big difference as far as what I do. It will make a difference if we were to start implementing the city threshold report again that used to be posted on the city website. That committee would review we need the daily case numbers in order to calculate that R, or the reproductive number. The Delta virus, and maybe we should do this on another presentation, is the Delta virus, that reproductive number that they're currently seeing is close to what the measles is, which is one of the most contagious viruses. Measles has an R value of 10. The alpha, or the variant, the initial virus, SARS-CoV-2, that R value was around 2. And they're thinking that this Delta variant is around 8. So, which just tells you that for every person infected, they can infect 8 more people. So highly infectious, up there near more close to the measles than the original SARS-CoV-2 virus. So if you look at Brookings, we had 3 cases this past week. I mean, we're looking really good. We're in minimal spread. The week before we had 2 cases, and you can see we're down here in that minimal spread. It's still around, but it is not going up at the moment. And hopefully we can keep it out of Brookings. If you look at the state, you can see an increase. The last week we had 105 cases, and the week before there were only 68. That's still low. We're below substantial spread statewide, and hopefully this can stay low and isn't starting to go back up, because this is a fairly large percent increase. Granted, the numbers are pretty low. The hospitalization data, again, this is a little bit confusing right now because of the data sets being cleaned by the Department of Health. What they're doing is they're going through the individual records, making sure people aren't being counted twice, making sure, that certain stipulations are met as far as defining whether or not a case was hospitalized due to COVID. And they are expecting to have that done by early July. So hopefully once that's finished, we can start calculating new admissions per day, because I actually calculate that based on on the dashboard, you'll see a number that says total number ever hospitalized. So I'll track that by subtracting the current one, or the previous one, from the current one, which gives you the new hospitalizations. Hopefully that makes sense out there. So I really don't know how many new admissions there were for this week, but you can see both here the total number currently hospitalized and the number in the ICUs. It started to swing up this week. Whether this is just a fluke, you do see it bouncing around, or whether this is the beginning of an increase, we can't really tell that at this point. But this past week, or as of yesterday, we had 27 people hospitalized. 8 of them were in the ICU. Last week, there were only 19 people hospitalized and half the number in the ICU. So there has been this increase this week. Hopefully it doesn't continue. Here, the deaths in the state of South Dakota, we had 4 deaths this past week compared to 6 the week before. So that has dropped. You wouldn't expect that to be increasing right now. This past week, it's important to note that 2 of the deaths, half of them were among individuals in the 30 to 39 year age group, and the other 2 were among the 70 to 79 year age group. And the percent of the population receiving at least 1 vaccine, I think this is important to show for Brookings County in the blue versus the state in the yellow. Brookings County has a higher vaccination rate in all age groups except this 18 to 24 year age group, where we're still quite low at only 23% of this population being vaccinated. And this is at least 1 vaccine. And again, just a reminder, with that Delta variant, you need to have both vaccines in order for to be highly effective. If you look at the United States, there were 95,000 new cases this week compared to 93,000, close to 93,000 the week before. You know, still it's relatively low, but this, you know, is a large number, and people need to be aware of that. And as you remember from that map, those new cases are centered, you know, there's hot spots. And I think that's what we've now come to, especially with this Delta virus or variant, is that variant is going to find the susceptible people. So it's going to be tied to places that have low vaccination rates. You know, that's where it's going to be hitting. The number of deaths per week, this dropped last week, nationally, with 1,581 deaths compared to a little bit over 2,000 the week before. Worldwide, you can see the effect here of the variant the last 3 weeks. We had 2.8 million new cases compared to 2.6 million the week before, and it is starting to increase. There have been 2 weeks now of cases going up. The deaths have not. They've been pretty steady, around 55,000 deaths per week the last 2 weeks worldwide. So one thing, you know, I've always ended this with talking about getting vaccinated, and I think that, you know, that's a decision people make, whether to get vaccinated or not. But I also just wanted to put a reminder out there for people to be cautious about the news that they get on social media. You know, check the original sources. Think about whether or not that's a valid media source. And all articles in a media thing should provide you with the original reference of where they got the data. And everyone can always go back and check that original reference and look at the data themselves. And if anyone runs across any data that they do that with, or news articles, and they see something and they want us to talk about it, you know, maybe it would be good for them to email you, Chelsea, and then we can look at that data and see what it actually means, or review it. So,
I think that's so important too, just to, you know, remember that data, just like anybody's words, can be taken out of context. And, you know, so if you only have part of the story, it may not tell the whole story. And data is the same way. You know, if somebody just takes one part of what you said and says it, and they didn't include the rest of it, you know, that can happen with data too. So when you see the full story and you see the full data set, it may mean a totally different thing than what you saw in that social media post, or that even an article that, you know, it may not be misinformation in the sense that, you know, that that number wasn't there, but if it doesn't include the whole data set, it can tell a
It could be
completely different story.
misinterpretation.
It could be misinterpretation as well, yes. So just think about the context that information is being used, and it's always great to find the source, because when you go to the source, you may see a different story being told. So thank you, Bonnie. If anybody has any questions, like Bonnie mentioned, especially if you see something in the media that you have a question about, or something on social media that you want, maybe an epidemiologist to look into further, definitely email us. So that email address is listed in the description of this video. And also, remember that when you are ready for your vaccination, it is available for you. Just contact your healthcare clinic or contact one of your local pharmacies and get signed up to get that vaccination. Even if you have the vaccination, you have some protection. Even with that first dose, it may not be fully effective, but there is some effectiveness. If you haven't gotten a vaccine yet, continue to ask questions to your healthcare provider and consider getting it, especially with this new variant that is highly contagious. That it's not extremely widespread like it is in other states here yet, but the likelihood of that happening is a high likelihood. Wouldn't you say, Bonnie?
Yeah.
Yeah.
Yeah. And it could be here.
Mm-hmm.
We don't know that. And we'll see.
Yes. So if you have symptoms, go in and get tested, and just ask those questions. So we'll talk to you again in a couple of weeks. And until then, if you have any questions, definitely reach out. Have a great week.